Now that we have come to the end of our 6 presentations, the floor is open for discussion. You can ask questions from any of the 6 presenters.
Yeah, my question is to Dr. Ratnamala Desai. It is a very good presentation. And what is the vaccine you use? Is it quadrivalent or bivalent?
For a long time in India, quadrivalent and bivalent were the imported vaccines. Recently, Serum Institute of India, the one which manufactured Covishield, they came up with a vaccine, quadrivalent vaccine, 6, 11, 16 and 18, which costs 2,000 rupees. The government said it will provide, initially they said they'll provide it at 400 rupees. Then they said they have allocated a separate budget for it, but nothing has happened. Each dose costs 2,000 rupees. Now there is a recommendation by WHO which says that in low resource settings you can give 1 dose also. It's equally effective. So we are at 1 dose and we are purchasing it at a wholesale rate of 1,400. So that 1,400 we are collecting from the corporate sector or donors. We have no resources, so resource is the main important thing. And I believe that even if whole of India has to be vaccinated, the Serum Institute of India cannot manufacture that many doses. It's difficult. Yeah. It's difficult because it's a huge country. And of course, some other countries are vaccinating boys also. Now, for instance, where people can afford 9 to 14, we are recommending 2 doses. Beyond 9 to 14, up to 26 years, catch up 3 doses. For my medical students, we are advising 3 doses because they are all 22, 23. They can afford. But when FPI goes to the field, it's the marginalized people. So we try to collect money from the donors and buy this vaccine, which costs around 1,400 rupees.
Okay, thank you very much.
It's quadrivalent.
Any other questions?
Nanovalent is also available in India, but it's each dose costs 10,000.
No questions? Then I'll ask a question from Dr. Monica. You mentioned about this novel approach to breast cancer in eye breast.
Yeah.
Yeah. What is the sensitivity and specificity of this screening method? I mean, you mentioned that it seems it is lower than mammography. Yeah. But I would like to know the sensitivity and specificity of it, as well as who can operate this. What is the level of training the operator need to have when using, which kind of a person we need to operate?
Okay. Actually, medical health professional can operate this, and training is necessary for this. And the second is sensitivity and specificity. It's approximately 89% of this device.
Thank you, Dr.
Yeah.
So, Dr. Usha, you described several myths and misconceptions related to cervical cancer screening. Out of those, which is the most commonest and how you are planning to address that?
The most common is the fear. Fear about the gynecological examination. So, fear and because it is unlike other examination, they have to go to a service provider and for this screening, and it's mainly the first thing is about the fear of the examination. Yeah,
okay, thank you. So this brings us to the end of this session, and we would like to thank all 6 presenters for sharing their experience on their research as well as best practices. And we would also like to thank our audience for being attentive listeners, and thank you all. Now over to Monica.